I'm Rita and I'm 23. I'm studying medicine at UCL.
I'm Peter Weaving, I'm a 53-year-old general practitioner. I've worked here in Brampton since 1983. I'm the senior partner of the practice. We cover 15,000 patients over 200 square miles of Cumbria.
My name is Eileen Smith. I'm 79 years and I spent all my working life in the health service.
On July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services.
The NHS celebrates its 63rd birthday today, but in England it faces its largest reorganisation since its creation in 1948.
Move back! Get back off the stage! Get back! Free healthcare is the right! They say pause, we say fight!
It's fair to say that the reforms have inspired very mixed reactions. Some have protested against what they see as privatisation by stealth.
It is really going to affect all of us.
While some believe that they're a necessary step to ensure that the NHS survives.
This is the way forward and this is what we need to do.
3 NHS workers, one at the start of her career, one long-serving GP, and one who spent all her working life in the service, spoke about their hopes and fears for the future. Andrew Bevan, the man who fought to create the NHS, wrote, "A free health service is pure socialism, and as such it is opposed to the hedonism of capitalist society." But that was then, and this is the current Secretary of State for Health, Andrew Lansley.
Hello.
Lansley's reforms include clinical commissioning, which means that consortiums run by GPs will control healthcare funding instead of primary care trusts. More private companies will be able to sell healthcare to the consortiums alongside the NHS. And there's an independent regulator called Monitor designed to encourage competition. But while these may seem like a radical change, in fact many of the reforms are nothing more than continuations of those begun by Tony Blair's Labour government when the process of marketising the NHS began in earnest.
Privatise it completely and wholly, and I would like to see muck NHS.
So, after a listening exercise earlier this year, Lansley, Clegg and Cameron returned with a new message.
It is time for the pause to end. So over the last few months, we have listened, we have learned, and we are improving our plans for the National Health Service.
We've listened, we've learned, and we're improving our plans for the NHS.
We've listened, we've learnt, and we are improving our plans for the NHS.
The 3 were repentant, but had anything really changed?
I'm the first medical student in my family. There wasn't really anything else that I wanted to do. I'd really like to work as a clinical hospital doctor for a few years, but then eventually go into public health.
I was actually trained in the practice here in Brampton and I just loved rural general practice. It was such a fantastic way of life. It was a very holistic way of looking after patients. We did absolutely everything for them. We did as much minor surgery for them. We did everything from ingrowing toenails to delivering their babies.
When I was 17, I decided to join the health service because I wanted to be a nurse. So I joined the local hospital, which at the time was called Park Hospital. It was a very modern hospital.
And there was just something about that continuity of care and the 24/7 nature of that care, which is something we'll probably never go back to, and in a way that's sad.
This badge is my state registered nurse badge, and that was always very precious to me, but I haven't had it out for a very long time. I felt I'd been working for that, and it was very important to me to become a qualified nurse, and this was sort of the proof, you know, that you could wear.
Mr. Henry Willink, Minister of Health for England and Wales, talks about the government's National Health Scheme.
I've been asked to tell you just a little about this new plan for better health. Our plan is a service which will provide the best medical advice and treatment for everyone.
And everybody was very excited about it, including me, and we were all amazed at the job that Andrew and Bevan had done to actually make a plan for making a comprehensive, universal and equal health service for all. I think Bevan was a very strong character, and that because of his work in the mines and because of the solidarity of the miners, he understood about solidarity.
I'm passionate about the NHS. I love the idea of it being free at the point of use for patients. I think that is a fantastic luxury.
On the wards, you were aware of the gratitude of the patients, and they were always saying, it's wonderful that I can come in hospital and be treated, and I don't have to be worried anymore.
There are too many reforms of the health service. I don't even know where to start.
The real reasons for introducing the healthcare reform were to meet the fourfold challenges of demography, developments in technology, public expectations and financial pressure.
When I first heard about Andrew Lansley's bill, when I trusted them to not do another reorganisation, I was so upset I actually couldn't sleep. And I kept turning it over in my mind, what can I do? How can I make a difference? How can I stop this happening? This leaflet here about kill Lansley's NHS bill does spell out what we will lose in the NHS. We'll lose accountability. We were losing the responsibility of the Minister of Health to take responsibility for comprehensive health care. He's now withdrawn that, but he's hiding behind a commissioning board.
In terms of stopping the reforms, the strongest lobby that we have to do that are the medical professionals. I guess as medical students, what we can do and what we've been trying to do is just inform people.
We're the big society! The choice is yours as taxpayers, as owners of the NHS, as owners of everything we give you.
There's quite a lot of people who don't really realise what's going on. Just raising the profile through publicity stunts, leafleting on the streets, actually make people feel that they can change things if they really do feel strongly about it.
My other role is a commissioning role, and I'm the co-chair of a commissioning group, a clinical commissioning group, which covers the whole of Cumbria.
Under the reforms, as Peter Weaving does now, all GPs will be directly responsible for buying or commissioning healthcare.
GP commissioners will not work. GP commissioners need to sit down with other healthcare professionals, particularly their consultant colleagues.
The consortia, I think, in themselves are a pretty terrible idea. I don't think doctors want to take on the responsibility of doing managerial roles as well as clinical roles.
These clinical commissioning groups will not be required to be open and transparent and have their meetings in public.
After the listening exercise, I guess there have been some changes put through which do start to rub the surface of the sort of problems that there are with the reforms, but it still doesn't really go far enough. There's still going to be competition in the NHS, which will pit different services against each other.
Competition in healthcare is a very interesting animal, and you can see a place for it improving quality in conurbations where you've maybe got big foundation trusts competing for patients.
I don't think enough research has gone into the actual impact of what these reforms are, and I think also the reasons behind them might not be for the purest motives.
I'm heartbroken when I think of the wonderful thing that we have, the precious thing that we have, something to make us proud in this country, that they're actually going to sell it for profit. It's corruption and greed, purely. And we will have American companies over here who have actually been up for fraud in the United States.
The evidence from places like Kaiser and other American healthcare providers is that their management costs actually pay off dividends in getting better care for patients. And Kaiser's healthcare costs are really quite high, but they produce much better outcomes than we do.
In America, the health system is appalling for the general population. They've got pockets of excellence for people who can afford it. But in general, their health is not as good as ours. Their outcomes are not as good as ours. It costs a lot more than our system.
Once private healthcare companies have one foot through the door, that first step is all they need.
Privatisation will reduce quality. I'm quite convinced about that. I know that as an infection control nurse, I had the perfect right to walk into any of the hospitals on my patch and do an inspection without even announcing that I was coming. If there are private hospitals, at the moment I couldn't do that. And the question is whether they will hide behind commercial confidentiality.
What I would love to see in terms of the future of the NHS is that it thrives under these reforms. What we're going to see, particularly in somewhere like Cumbria, is the hospitals are going to be much smaller. They're going to have fewer beds in them. Far more care is going to be provided in the community, and the technology is going to drive that. We are not going to be able to afford to fund the present number of hospital beds we've got in the country.
If I could speak to Andrew Lansley, I would plead with him, please just drop your bill.
if Andrew Lansley was watching this video, I think I'd ask him to resign.
I would say to Andrew Lansley that putting clinicians in charge of the decision making in the NHS is exactly the right thing to do, and it's clinicians with patients going forward that will make this work or fail.
It's a strange thing, but I felt that after the war we had a group of people who were principled, and now I don't feel it at all. I've lost any trust in them. I think that solid moral foundation has just gone out of public life.
I think I'd also ask him to swallow his pride. I think just cut it off.
I'd like to see the restoration of the primary care trusts, who are doing a very good job, but with more medical and nursing representatives on it. And I'm sure that if we continued in that way, we'd just have the best health service in the world.
We've set foot on the road. We can't go back. We're already sort of started on this journey. But could we have done it simpler and more straightforwardly? I don't know. I mean, it maybe did need the big push to actually make it happen.
It was written in such a short time. It's being bulldozed through. There's true anger about this, and I think it's really something that can bring this government down. So it's something that people need to rally behind.